For weeks, we've been sharing stories of coronavirus hotspots in the South, but communities in other parts of the country, including the Pacific Northwest, they're suffering too amid this latest surge. Hospitalizations in Oregon hit a record high yesterday. ICU beds are at 93% capacity statewide. Oregon's governor has now deployed National Guard members to more than 20 hospitals, and many health systems have canceled elective surgeries. The staff at Asante Rogue Regional Medical Center invited our Janet Shamlian inside to see the heartache for the staff and their families.
Visitors aren't allowed in the ICU, and yet 3 of the 15 rooms here have family members in them right now. They're not here for a visit. They're here for a last visit, to say goodbye.
There's constant turnover in this Medford, Oregon intensive care unit, but not because patients are getting better.
How bad is it right now?
I mean, every day we see just the body boxes roll out one after the other. And then as soon as we clean the room, we get somebody back in there. It's the worst we've ever seen.
ICU nurse Clarissa Carson says relatives used to be able to stay in these rooms to grieve after loved ones passed as long as they wanted. Now they have to be out in less than an hour, so another COVID patient waiting down the hall can get in. There's only one ICU bed available in the entire region.
We have patients waiting to get onto life support.
There's no escaping the anguish. As we were listening to ICU Dr. Somnath Ghosh,
the turnaround is so rapid, it's pretty sad.
As I'm talking to you, doctor, what you can't see is that we can hear family members coming out of a room and they are crying because, why?
Because we withdrew life support and chances are they just passed. These patients are on such tremendous levels of life support once we stop that they last less than a few minutes.
Suffering and sorrow are now part of every day.
I've never seen so much death in my career. We're surrounded by it.
ICU manager Kelsey Robinson is frustrated by vaccine hesitancy. Just last night, hundreds protested vaccines outside the hospital, many who said they were hospital staffers.
Our community is getting ripped apart by the people who don't believe in the vaccine, the people who do.
Most in this intensive care are unvaccinated. Every patient except one is on a ventilator. They are so sick, Nurse Carson says, the odds are against survival.
The grief is tremendous. We are used to winning. Us ICU nurses, we're used to winning, and we're not winning. We're losing.
And there will be more loss, what some are calling collateral deaths. Dr. Ghosh tells me they have put off more than 100 heart surgeries over the past 2 months because there is simply no room for those patients here, no resources. Some of those patients, he says, will likely die. Anthony.
Just a devastating story, Janet. Thank you very much.